So how do we approach the lower eyelid area in guys to help preserve masculinity and maintain a natural appearance? Like with ladies, we do approach it through the inside of the lower lid, and that's through what's called a transconjunctival approach or a scarless approach. There's no scar on the outside. That helps to allow us to reach the lower lid fat pads and take those out nicely without any significant possibility of pulling down the lower eyelid with healing, which is what can much more frequently occur in the external approach to the lower eyelid. Secondly, we do fat transfer for the lower eyelid area to blend the lower lid to the cheek area. And there's similar amounts that we use for ladies in that area, maybe not quite as much along the rim. But importantly, for the anterior cheek or front of the cheek, we use much less than in ladies. So maybe about a third as much as in ladies, because we don't want quite as much of a cheek area even in the front. And then lastly, we avoid or use very minimal lateral cheek or outer cheek. We don't really want a heart-shaped face in guys. We want more of a square face in guys to help preserve that masculinity. So some important points to keep in mind when treating the lower eyelid area to help prevent that unnatural or over-treated appearance or a feminized appearance. Hope that helps. Feel free to ask any questions below. Take care.